I'm Dr. Edwin De Jesus. I'm the Medical Director for the Orlando Immunology Center.
Orlando Immunology Center, OIC, is a world-renowned medical care and clinical research center for advancing treatment and prevention for sexually transmitted diseases. The medical team at OIC has built a global reputation in the HIV scientific community and offers the latest developments in infectious disease and internal medicine applied to sexual health.
OIC started as a need for the Central Florida community to have a research center to conduct study related to HIV treatments. Back then, HIV was very different. When I came to the Central Florida area in 1993, over the following 5 to 6 years, that was the peak of the HIV epidemic in the United States. That was the peak when more people were dying from HIV in the United States. We decided to create a research facility where we can actually obtain and get access to all those life-saving experimental treatment that the community needed. And we did so with quite successful, and that's how OIC was born.
My name is Charlotte Roll. I'm an adult infectious disease physician.
I am Dr. Inestrosa, and I am the Director of Clinic Operations at Orlando Immunology Center, OIC.
I'm Michael Seibert. I'm a board-certified internal medicine physician, as well as an HIV specialist credentialed with the American Academy of HIV Medicine, and I run the anal dysplasia clinic at OIC.
Hi, my name is Jeffrey Garrett. I'm a nurse practitioner at OIC. I studied at Florida State University, and I specialized in things viral such as HIV and hepatitis C.
I am Philip Maxwell. I'm a board-certified physician assistant.
For decades, OIC has been conducting landmark clinical trials that have led to the approval of medications that revolutionize the care of people infected with HIV and hepatitis in sexually transmitted diseases. Some of the most significant milestones achieved by the clinical research team includes the participation in the development of every single antiretroviral that has been commercially available to treat those living with HIV.
Shortly after OIC was created, we were very successful in recruiting those studies that were needed for the approval of those medications. We have the perfect population that they were looking for the approval by the FDA of those life-saving medications. As a consequence, we were able to participate in many of those studies, and that led us to present in large HIV conference and infectious disease conferences the results of those studies. We were also able to publish and be author of many of those studies that led to the success that we are seeing today in HIV. So we were not only successful nationwide, but worldwide in the field of HIV. That also translated in set up the gold standard in which HIV should be treated in our local community. And after that, there were many other clinics locally that has been following the standard that we set back those days.
Certainly our role in the development of every single antiretroviral that's commercially available on the market, I would argue definitely helped us have a role in general population health. When we think about general population health, we think about treatment as prevention in terms of being treated for HIV, having an undetectable viral load, and not being able to transmit that to someone who's uninfected. That then falls into the realm of general population health. The OIC has also been at the forefront of prevention research, PrEP research, and again, that's been an important role for us to play in the community, bringing new options for HIV prevention to the general population.
The impact of our research in sexual health is amazing because we were part of the leading clinical trial for PrEP. Right now, that's one of the strategies that is broadly used across the world in terms of prevention for HIV. I'm glad that we were part of that amazing clinical trial, which make a huge difference in how to prevent an infection such as HIV. We continue to have amazing impact in development of new HIV drugs, new HIV treatments, because we all know that in patients who are infected with HIV, when they are on treatment, when they are undetectable, they don't transmit the infection to others, and that's a huge impact in sexual health.
OIC also played an important role in the success of finding a simple and effective cure for the hepatitis C virus.
OIC has been involved not only in HIV and PrEP, but also we did exactly the same thing with hepatitis C. In fact, every single anti-hepatitis C medication that is currently in the market has been tested in our facility.
When the hepatitis C drug development started, we had the opportunity to be part of this development, and actually one of the most successful molecules that we use as of today in the treatment of hepatitis C, that is called sofosbuvir, we participated on the early clinical phases of development of this drug. We were one of the first 3 sites that actually provided this medication for a patient in the world. We were so glad that we were participated on that, and now this is a medication that we use as of today as one of the core antivirals to treat and cure hepatitis C.
Prior to that research being completed and the discoveries brought to market, people received chemotherapy to be treated for hepatitis C. The treatment was very rough, and there wasn't a large group of people that were cured by it. It was like 50%, but they went through chemotherapy side effects such as losing hair, having to take time off of work. Our new medications, because of research, usually someone takes a pill or 2 or 3 for 8 to 12 weeks. They have very little side effects. They continue to work, and their cure rates are up in the 98, 99%. So I'm really proud to be involved in OIC's research. One of the things that I'm most proud of, having worked at OIC, is to be involved in research for hepatitis C. There's nothing quite as gratifying as telling a patient that they've been cured from a disease that in the past was one of the #1 causes of liver cancer. There's just nothing like that warm feeling and that bond that you get with a patient when you're able to tell them that they've been cured.
When a patient comes to me and tells me that I cure his or her hepatitis C, is one of the greatest satisfactions that I have as a medical doctor. So I enter the room, they already see my expression in the face, and that kind of sets the mood for the visit. And it's a very emotive situation. So many times patients, I can see them that they're so emotional that there's tears of happiness and hugs. It's a very emotional visit, and I really enjoy when I tell patients that they're cured of their hep C.
OIC's work has been recognized by the National Institute of Allergy and Infectious Diseases, as well as the National Institutes of Health. As a result, OIC is frequently sought after to help conduct challenging government-funded studies. Additionally, Central Florida has always been impacted by the high rates of infectious diseases, where OIC frequently has access to the high-priority populations that government-funded trials seek to enroll.
We were able to do the same with other conditions, and we continue to do the same by creating affiliations with other research centers and scientists such as the NIH. And for example, recently with the COVID epidemic, we were selected by the NIH as one of 2 centers in Florida to participate in the COVID vaccines and COVID treatments. So we have continued to do that, and we will continue to do the same in the future.
In addition to its pivotal role in clinical research, OIC provides comprehensive medical services, including screenings, prevention and treatment, sexually transmitted diseases, hepatitis, HIV, and emerging infections such as COVID-19 and monkeypox for all sexually active people in Central Florida in a comfortable, non-judgmental, and private environment.
Sexual health medicine at OIC differs from other clinics in that our patient population is a broad, diverse group of people, sexually active adults who come with different sexual interests and therefore different needs. And our staff is very well trained to provide non-judgmental, thorough sexual histories. And patients are really able to speak with our providers openly and talk about all of their concerns in a very non-judgmental, safe environment.
We currently offer in OIC a variety of clinical services in an open, non-judgmental environment for population who are sexually active, population who are dealing with chronic infections such as HIV infection, hepatitis, on a non-judgmental, open way, providing primary care, because primary care is a very important part of preventative care. So that's where we teach the patient the different strategies that they can use to prevent infections, vaccines that are already available also to prevent important infections.
Of course, much is geared towards our sexuality because, let's face it, as sexually active people, the healthcare system hasn't been very friendly to us in the past. We've changed that, and you'll notice the difference when you come through our doors. It's important that you stay engaged in your sexual health care.
Specialized primary care involves the care of sexually active adults, particularly people living with HIV. In the general population, primary care for patients living with HIV often doesn't encompass all of the risk factors that people living with HIV have. In addition, specialized primary care also at OIC really looks at the person as a sexually active adult, and we take into consideration all the preventative care that needs to be involved in sexually active adults as well.
So what we're doing is we're really focusing more on background, your infectious disease processes. We're managing that as well as all your other primary care needs. And also with SPC, we do sexual health integration with anal pap smears, oropharyngeal, and rectal swabs for, let's say, chlamydia and gonorrhea. Primary care offices more so focus on your health and wellness, whereas if you're just having, diabetes, high blood pressure, rheumatologic conditions, they're able to go and help those particular problems. But with SPC, we definitely offer a more broader range of services.
Another part of specialized primary care is to address preventative care for sexually active adults. One thing that our clinic provides are anal paps. An anal pap is something that most patients aren't aware of, because a lot of other clinics don't provide that type of service. And a lot of doctors don't even know how to do anal paps. And so an anal pap is essentially a swab that we introduce into the anal canal and collect superficial cells that then get evaluated for any abnormalities. Any abnormalities then get sent off to our anal dysplasia clinic for the high-resolution anoscopy.
Any sexually active person over the age of 30 benefit from having an anal pap smear, both male and female. HPV does not discriminate on where it does its damage. It does it in both sexes.
At OIC, we have a male hormone replacement clinic that I'm a part of. In that clinic, we evaluate men who have symptoms of low testosterone and evaluate their symptoms with labs. And then, if appropriate, we provide therapy to treat their low testosterone.
We also provide weight loss services where we can assist you with your diet plans. We have pharmacotherapy that's available to help you lose weight. And in rare cases, we can even refer you for bariatric surgeries. That's another service that we offer at OIC.
OIC's team of experts remain at the forefront by participating in clinical trials, enhancing the management and prevention of infectious diseases. The triumph of these trials translates into not only improved sexual health, but also heightened well-being in the realm of sexual health for all.
The OIC Research Director, representation in clinical research has always been a very big passion of mine. It's something that I have been working on in almost every single step of my career, trying to make our research services more accessible to the diverse communities that our clinics serve. It is well known that the HIV epidemic disproportionately impacts communities of color, diverse communities, vulnerable populations. And so it's important to have those populations represented in clinical research. One thing we've done in research for many years in the history of HIV medicine is extrapolate results from populations to other populations that may not necessarily have the same background, may not necessarily have the same social circumstances, may not necessarily have the same pharmacodynamics and pharmacokinetics. And all of those factors really impact how drugs work. And so it's very important to include a diverse community in clinical research so we have an idea of how drugs work in a large number of communities. Right now, it's something that our field has really been struggling with. At the OIC, we've made very concerted efforts to include more diverse communities, but it's something that obviously we still have room to work on. PrEP in women, it is such an important topic. It is a topic that we don't talk about enough. I think people have started to recognize the importance of PrEP in women, but we haven't actually taken the steps as a field to implement PrEP in women in what I think is an effective manner. You know, women, even though the rates of HIV have been declining in women over the past few years, women still account for 20% of new HIV diagnoses in the United States, and 85% of that is through heterosexual contact. So clearly there's still a need for PrEP in women. Here in Orange County, if you look at the actual local statistics, you know, women over 50 is still one of the only groups in which the number of HIV cases is still increasing. It's actually decreased in every other single demographic, right? And so I can't underscore the importance of HIV prevention options for women. We haven't done a good enough job of making women aware of PrEP. We haven't done a good enough job of offering women all of the available HIV prevention options. It's not something I think that a lot of providers are very comfortable talking to women about. And so at the OIC, we have been working to create sort of more innovative ways to get PrEP out to women. And
clinical research is the study of new medications for the treatment and prevention of disease, and it generally utilizes people with or without the disease of interest to prove the efficacy, safety, and tolerability of these medications. Once the research is concluded, people can access these medications and improve their health and well-being. That is the importance of clinical research.
So in terms of representation in our clinical studies, I mentioned all of the things that we've been doing to reach out to diverse communities. So if you're looking at this and you're interested in participating in one of our research studies, definitely reach out to us. We have something for everyone, literally. You know, we have studies for HIV prevention. If you're not living with HIV, if you are living with HIV, we have a ton of treatment studies, right? Whether you've just been recently diagnosed and you want to get on treatment through a research study, whether you have been living with HIV for many years and you want to know what's new out there for HIV treatment, and even what's new for HIV cure. You know, HIV cure is a hot topic in our field right now. I'm really happy that OIC is at the forefront of so many of the amazing cure studies that we have out there. And so if you're interested in that, definitely check us out. If you're struggling with controlling your HIV and you need a new option for treatment because you have not been able to achieve viral suppression, guess what? We have a study for you too. We have something for everyone. Again, we love our research patients. They are at the heart of what we do. We go out of our way to take such good care of them. You guys are a part of our family. And so if you're, again, interested in participating in clinical research, we'd love to have you join our research family.